Hi, my name is Teresa Gradias, and I will be giving a short instructional video lesson regarding the human eye, its purpose, the functions, common diseases of the eye, treatment and management for these common diseases, nursing management, including health promotion for the eyes, and teaching for self-care. The eye is a sensory organ that allows us to see visual images in our surrounding and converts light into nerve impulses. The optic nerve of the eye transmits these nerve impulses to the brain, in which the brain forms an image and returns sight and allows us to see. How amazing is that? It sounds simple, but there are so many parts of the eye that work together to make this happen. Now to review the main structures of the eye and the function they provide. First, I will review the external or outer part of the eye, starting with the eyelid, which is this outer portion here. The eyelid is the upper skin flap that covers a portion of the eye and covers it fully when blinking. The function of the eyelid is to protect the surface of the eye and to stop bacteria and foreign objects from entering the eye. The eyelids also provide a blinking motion that provides moisture to the eye to prevent dryness. Each time we blink, secretions from the tear glands glide over the surface of the eye that sweep away smart particles and provide lubrication. This is an involuntary function that is controlled by the brain. The pupil, which is this dark area here right in the center, the pupil controls the amount of light that enters the eye. The pupil can constrict and dilate to determine how much light is allowed. When bright light is present, the pupil will constrict and become smaller to prevent too much light and to prevent damage to the retina and the rest of the eye. When a physician needs to visualize deep into the eye, they will dilate the pupil to enlarge it to gain visual access to evaluate for eye problems. This sclera, which is the outer white portion here, the sclera is the eye's support and provides the shape of the eye. The sclera is glazed with mucous membranes that lubricate it to moisten the eye and to provide a barrier to foreign objects. The sclera is attached to muscles that provide movement of the eye. The iris, which is the color portion of the eye. The iris is the color part of the eye. The iris works with the pupil and is the reason why the pupil dilates or constricts when exposed to light or darkness. The iris will expand or contract to control the amount of light allowed in. The iris is what determines and controls when the pupil dilates or constricts. Next is the cornea, which is this outer portion here. The cornea is the eye's outermost lens. The cornea covers the pupil and the iris, and its function is to bend or to refract light. The retina. The retina is this back portion here. The retina lines the back portion of the eye. It consists of photoreceptors that processes visual information and is also responsible for light and sends signals to the brain where visual information can be recognized. The macula, which is this yellow portion here along the eye, back rim of the eye. The macula controls the central vision of the eye and provides the ability to read, see people, and detail of images. It is responsible for middle and central vision of what is directly in the center of your vision. The optic nerve, which is this right here in the back. The optic nerve is part of the central nervous system. It transmits electrical impulses to the brain, in which the brain then processes these impulses and provides sight. It provides sight of color, brightness, and perception. The lens, which is located right here behind the iris. The lens sits right behind the iris. Its function is to bend light to aid in seeing images clearly. The lens also changes shape to allow near and far vision. The three most common diseases of the eye that I chose to review are glaucoma, macular degeneration, and cataracts. Cataract is when the optic nerve is damaged, and this is the optic nerve right here. When the optic nerve is damaged, a person can experience blind spots in their vision. Nerve damage is caused by too much pressure in the eye. Common symptoms of glaucoma are headaches, eye pressure, redness, eye pain, blurred vision, or tunnel vision. There is no cure for glaucoma. but it can be treated to prevent the worsening of the condition. As mentioned, glaucoma affects the optic nerve. Glaucoma is diagnosed by a medical eye doctor by using visual field testing, an eye pressure test called tonometry, a dilated eye exam, or a gonioscopy test. Glaucoma is treated by lowering the eye pressure in the eye, known as intraocular pressure. Treatment options include eye drops, oral medication, or laser treatments. Depending on the severity of the glaucoma, the physician will determine which treatment is the best option. Nursing management for glaucoma is implement measures to assist the patient to manage visual limitations such as reducing clutter in their home and advising to turn their head to view a particular object that might not be visualized. Educate and stress the importance of a healthy diet and foods that promote eye health, and to be compliant with medications that are prescribed for glaucoma, such as timolol. Macular degeneration, which affects the macula, which is right along here. Macular degeneration affects the macula and is the loss of central vision. Peripheral vision is usually still intact, but the central vision is either reduced or completely lost and looks like a black hole or spot in the middle visual field of a person's vision. Common symptoms of macular degeneration are blurry vision, loss of central vision, black spots in a person's visual field, and visual distortion. Causes include high blood pressure, stress, smoking, obesity, and even diet habits. Macular degeneration cannot be reversed, but it can be prevented from getting worse with the proper medications. Macular degeneration is diagnosed by a medical eye doctor and/or ophthalmologist. An eye examination is performed and the eye is dilated so the physician can view the macula in a magnified view. Additional testing might include a fluorescein angiography, optical coherence tomography, or tonometry testing. Treatment options for macular degeneration are eye injections of anti-angiogenic drugs, which stop new blood vessels from forming to avoid leaking from the abnormal vessels that cause the degeneration. Other options are laser treatments, vitamins, and oral medications to prevent worsening. Nursing management for macular degeneration includes providing education on treatment options, educate on lighting, and encourage the patient to visit their eye doctor on a regular basis. Encourage the patient to take their medications as prescribed. Medications that are commonly prescribed for macular degeneration are Eyelids over-the-counter, Avastatin, Lucentis, and many more. Cataracts are the cloudiness of the lens, which is located here. A normal lens is clear. However, if a cataract is present, it's a fog or hazy light that causes blurry vision. Cataracts usually come to be as a person ages or from injury. Symptoms include blurred vision, double vision, sensitivity to light, halos, difficulty with night vision, and of course cloudiness and haziness. Cataracts cannot be prevented, but eating foods that are high in vitamin C, vitamin E, and lutein can help in eye health. The common tests used to diagnose cataracts are a retinal eye exam, a slit lamp exam, and a visual acuity test. Treatment for cataracts is surgical removal of the cataract. The cloudy hazy lens is removed, and an artificial clear lens is placed. There is no medication that can correct a cataract. A surgical procedure to remove the cataract is the only treatment available as of now. Nursing management for cataracts can include educating the patient on what the cataract surgery entails and what to expect. Educate the patient on visual changes as a person ages, assess the patient on their visual ability, and medications used for cataracts are antibiotics, corticosteroids, and anti-inflammatories. This concludes my educational video. I hope you enjoyed it and stay healthy.